Welcome to our focus on Facebook Live. My name is Hasnain Kermali. I'm the Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut. Each month we like to highlight various clinical and specialty services that we're able to offer from our hospital here in Waterbury and how we connect with the community and the expertise and insights that we're able to offer here. Today I'm really excited to offer and bring to us someone who really needs no introduction to the Waterbury community, but we're going to introduce him nevertheless. St. Mary's Hospital Medical Director of our Wound Healing Center, Dr. Peter Jacoby. Very nice to see you again, and thank you for taking the time out of your busy schedule.
As always, a pleasure to be here.
To sit with us. So Dr. Jacoby is an icon here at St. Mary's Hospital. And has been a part of not only the medical but also the philanthropic community for decades, and has been a leader here in a variety of roles. Tell us your journey here, coming to Waterbury, and sort of the path you've taken and where we sit today.
Well, I'll try to give it in a very brief overview, but I actually started as a resident here in internal medicine many moons ago in 1977. Completed my residency, but really had a passion for the emergency department.
Sure.
Started working in the emergency department at the same time, actually working in the Family Health Center, and began the first Spanish-speaking clinic.
Beautiful.
Because I am bilingual. And then really had the passion for the emergency department, so I went full-time there, became the associate director somewhere in the mid-'80s, and was named first chairman of the Department of Emergency Services in April of 1991. I remained in that position until August 2021, when I semi-retired and went full-time or part-time semi-retired at the Wound Center at St. Mary's.
Well, I mean, it's been great, and your expertise and your drive and your vision for our emergency room has made it what it is today. I think a leading emergency room here in the city of Waterbury, and we're excited that your protege, Dr. Bergward, is now our emergency room director downstairs. But the Wound Center is your baby.
Yes, actually, it started in 2004, 2005. I think it was 2004, when our then CEO, Bob Ritz, said, do me a favor, Peter, just get this program up and running, get it off the ground, start it up. I had done a number of courses in wound care, had been out studying about hyperbaric oxygen treatment and wound care, and said, be happy to. So I did one clinic a week in order to get it up and running.
Yeah.
And as time progressed, I did a few more. And then when I semi-retired, I decided to become the medical director and stay on at 20 hours per week in the wound center.
Why do we need a wound center? Why can't patients get their care at their doctors?
It's a great question, but when we tackle wounds, we see them on a weekly basis. So let me put it into real layman's terms. Layman's terms is the body heals you. We don't have anything special. Wow, do I have magic dust and I throw it on there and you're all better?
Right.
The body has to heal you. But as your wound gets old, the body says, leave it alone. It's an old wound. Let it sit. We don't have anything to do. So in reality, we take an old wound and make it into a new wound every week.
Okay.
So we reduce what we call the biofilm, the breakdown of our cellular products that sit in a wound. We clean that out. We get down to good, healthy bed, and we have new products on the market that stimulate the growth of the wound, and so we can heal the wound. Our average time to healing is about 6 to 8 weeks.
Wow.
And you may say, wow, that's, you hit your leg. It could be 4 months.
It can be a while, yeah.
And if it gets infected,
sure,
big time problem. Now you're in the hospital, now you're admitted, now you're getting antibiotics. So we have said to people, come to see us. We'll get you healed much faster.
When we say wounds, what kind of wounds are we talking about? Are we talking about, like, I scraped my hand, I need to come see Dr. Jacoby? What kind of wounds are we talking about?
Well, if it was you and you scraped your hand, I'd look at it and say, okay, you're fine, goodbye.
Right, thank you.
Potentially. But as we get older, people who fall, people who scrape themselves, people who have things hit their arms, they don't heal quite as well. Because there's more to healing than just the wound. There's offloading of the wound. So let's say you hit your arm. Can I maintain it, elevate it, and not? You know, if I have a cut on my elbow and I do this all day long,
Sure.
it's not going to heal.
Not going to heal.
Then there's a huge population of patients who suffer from diabetes.
Yes. Yes.
Diabetic wounds are probably our number one visit
Yeah.
to the wound center. And many times in the emergency department, I would walk in and see a patient and say, so how long have you been diabetic? Oh, I'm not. Oh, yes, you are. You know, that wound on your foot that you've had for 3 weeks and you never knew about,
Yeah.
that's a major.
Right.
So it's a holistic approach that we take in the wound center. And by holistic, it's more than just your wound, but it's getting your sugars under control. It's making sure your vascular status, your arteries and your veins are working properly. If you have leg swelling, how do we tackle that problem? How do we make that better? Because I can cure the wound, but if I don't make the leg swelling go away, it's going to come back. So it is this approach to the body in general, and particularly the wound. So we say to anyone, if you have a wound that is not improving in a few days, let us know. In the emergency department, I've become their off-ramp, as in the urgent care centers.
Yeah.
Call us. I will see them within 24 to 48 hours. And there's very few patients who complain, you mean I'm going to go home now and I'm going to get to see the wound center tomorrow morning? Yep. I'll take it.
Right. And what's, again, a focus of ours is that we're putting the patient right in the middle. Like, we're not just focusing in on one thing. You're talking about a complete patient-centered approach to managing their issue.
Absolutely. So again, I go back to the word holistic and patient-centered, but we don't work in a vacuum either. So if you have a potentially infected wound, I have no problems calling right upstairs and saying to our superior staff in infectious disease,
Yeah.
I mean, those docs are great. Hey, I got this, this, and this. Let me come down and take a look and let's work together. Or our partnership with interventional radiology to do vascular procedures, or vascular experts that we're working hand in hand with now to say, you need this procedure. I can get your wound fixed, but your veins have to be fixed. And it becomes a real general approach to how do we make this patient better. Always remembering that they have a primary care physician and we're not excluding them. They're being kept in the loop of what's going on.
Of course. And then we talk about the diabetes issue. And I imagine we continue to work on that piece of the puzzle, utilizing both the primary care physician and the endocrinologist. And I'm happy to say, you know, even here in Waterbury, one of our challenges has been increasing access to endocrine.
Absolutely.
And now I'm happy, you know, we're happy to report we're having new endocrinologists joining us over the summer in July and August. So we're improving that to continue to tackle the diabetic case.
And I have a boatload of patients waiting to get in. And I'm very serious, because just last Friday a patient said to me, can you get me to see someone as soon as possible?
Yeah.
Because I know I've got to get my diabetes under control.
Yeah.
And I need a dietitian to help me with my food intake. One of our nurses, without even mentioning names, but she would not have a problem, is diabetic herself and counsels the patients on what's the best thing to eat.
Yeah.
We are heavy into protein intake, vitamin intake. What other things can make your wound better? And I'm also happy to say that some of our patients actually say, you mean I'm cured? I love coming here every week. This is my day out. This is a pleasure.
Yeah.
Because it's the staff that makes it go.
Yeah.
I mean, hugs, real nice feeling. They walk in, patients have said to me, I feel like I'm coming home. It's such a warm atmosphere. The nurses are so good, so caring, so centered to the patient. They know everything that goes on in their lives as well, and how did this go, and how was your granddaughter's graduation, and how did this happen, which makes a patient feel very good about coming to the center.
Well, it's what's important to the patient as well.
Yes. And patients heal because they feel better. Yes, they need the medicine. they need certain things, but
Right.
they have to feel good about themselves and say, so if I use this protein drink, I might get better faster, and I'm taking this and I'm doing this. And yes, all that is an approach we like to take.
Wonderful. So let's talk about how we heal the wound. Let's talk about some of the treatments that you're able to offer at the wound center that are novel, that are unique, that are groundbreaking.
So we have many new products on the market. Matter of fact, we just a month ago started with a brand new product that has just hit the market. But they presented to us, I read a number of studies on it, and I said, we're going to give this thing a shot. It's good. And we have about 5 people that I'm treating it with, all of whom are getting better.
Great.
And I'm working, actually, I just sent a letter to a dermatologist outside this area about using this product in a very difficult wound to treat. So there are products, but there's also, all right, if you're diabetic, how do I get, what are the little things I can teach you?
Sure.
I mean, it sounds stupid, but, you know, don't ever wear dark socks. You're only allowed to wear white socks.
Okay.
You can wear, if you have a suit and say, I need to wear a blue sock with this, that's okay, but put a white socket or sock under it. Because when you take, if you don't feel your feet and you take your socks off and you've been bleeding and you have a black sock, you'll never know.
That's right.
So it's understanding about neuropathy.
Yeah.
It's understanding on how I treat my diabetes. If it's arterial, how do I make myself better? It's the constant talking to them about cigarette smoking.
Yeah.
As much as we'd like to say it, people still smoke.
People still smoke.
And it's, you got to stop the cigarettes. You
Right.
got to keep your vascular status up. If it's a venous problem, we've got to work to compress your legs, put you in wraps, use compression socks, which all of us in the wound center wear all the time because we stand all day. And even friends of mine who work in industry where they stand all day, I've said, wear compression socks, and they've come back and said, what a difference. My feet aren't as tired at the end of the day.
Small things.
Small things in life that you never think of. Even if you're home, watching television, reading a book, reading the news, put your foot up. Elevate it a little bit. Get the swelling out of our legs.
And it's beautiful to hear that the teaching and the education on these on the common things that we forget when we have a chronic disease like diabetes, the nerve issues that occur, the neuropathy like you're talking about, the nerve issues, or the vascular, the issues with the veins and the blood supply. Correct. And all of that, because it's all impaired in diabetes, leads to these wounds that form and then have a really tough time to heal.
Right.
Easily infected because of the sugars. The bugs love the sugars.
Everyone loves sugar, right?
And so now you've got a wound that doesn't have great blood supply. You can't feel it because the nerves aren't doing great because the sugars aren't under control. And you got this perfect storm. And yet a simple thing like having a dark sock versus a white sock, to know or not to know that you actually have a wound.
Correct.
Which is the first step.
And the other thing we do is we teach patients to be very cognizant of changes in their wounds. So if someone says, you know, there's just a smell I don't like, come in. We'll see you, because if that's possibly gotten infected, I want to draw the culture right now. I want to jump ahead of this wound.
Right.
I don't want it to fester for a week. So when I see you, it's, oh boy, now you're going to have to be admitted.
Right.
If I can keep you out of the hospital, keep you as an ambulatory patient, I do. And then, of course, we have hyperbaric oxygen.
Yes.
Which is...
Let's talk about hyperbaric oxygen.
It's a great adjunct to our overall therapy. So hyperbaric oxygen has been around for years.
Okay.
People know about it because of the bends and when you were scuba diving and you came up too quick and they would put you into the chamber. But we've also found that it has great use in healing wounds.
What does it do?
Well, it's a simple process.
Okay.
We're taking 100% oxygen.
Okay.
We're putting you at different atmospheric pressures, much like scuba diving.
Okay.
And we're forcing that oxygen into areas that would otherwise not get such a high concentration of oxygen.
Okay.
We only heal because we have blood supply, which carries oxygen, which allows the body to heal us. But if you can't get a good blood supply down to your foot, or you can't get the oxygen you need down to that foot wound,
right,
we have to find a way to get it there.
Okay.
And one of the ways is hyperbaric oxygen treatment. Now, insurers and governmental payers limit the access that we have, but we always make sure that it's covered and that it is a diagnosis that they will say, yep, 100%. And that allows us. I mean, we've had people who've come in and said, they were going to cut my leg off. No, hold on. Give us a shot.
Yeah.
We are still involved in limb salvage.
Yeah.
That's our first goal. Can I save the limb? Can I save the toe? It may not always work, but give me the shot. And if I have the shot, then maybe I can have you walk out of here without a problem.
Yeah.
And that's when that therapy comes in, interventional radiology and vascular help, the work we do with vascular experts, the work we're doing with everybody to say, how do we salvage that limb?
That's amazing. I mean, we're talking about a technology that isn't new.
Right.
It's not like brand new research that has been done over the past. We're talking about a older technology. We're repurposing it to function and achieve an outcome that's better for patients, that saves their limbs, literally, and it's something that's available right here. How many of those machines do we have?
We have 2 machines, and we can run them all day long. I mean, it is a commitment on the part of the patient.
Okay.
Because they're coming in 5 days a week for a minimum of 30 to 40 treatments.
So it's a program.
It's a program. You come in, we put you in a gown, in the chamber you go. There's always someone watching you when in the chamber. And I have seen incredible improvement in wounds, really limb salvage. I've seen patients with radiation injuries from a cancer who were radiated, who got complete relief and healing of tissue. That was one of the original uses of the hyperbaric chamber. And nowadays, they're looking at it, although this is not yet covered by the insurers, but they're looking at it for early dementia. There's some studies out of Israel that have shown improvement in patients with early dementia because they've been in the hyperbaric chamber. It's, medicine evolves every day.
Yeah, yeah.
And it's fascinating to be a part of it.
So let's talk about those things that are fascinating. New things on the horizon. What's exciting you in the world of wound?
Well, I think what excites me the most is making the patient better. So we have a bell downstairs that we ring.
Love the bell.
Oh, when you hear that bell, that means somebody's been discharged.
Wow.
And I can't tell you how many patients say to me, when do I get to ring the bell? When we discharge you.
Yeah.
There's this excitement that, I've had this wound for 6 months. Yeah, I've only had you for 6 weeks. You got to give me a little time. So start from 6 weeks ago.
So we've seen bells in other areas.
Yes.
Like when patients in other prolonged therapies graduate from them.
That's what we call it, the graduation from the wound center. And it's amazing that they all just want to ring the bell. That means I'm graduated and I'm out of here. And they all know they can come back, so we have recurrent patients who say, I got this wound, I didn't want it to get bad, I came right away. The excitement to me, I've had some patients with some very, very difficult diseases, one of which is called calciphylaxis. And this was a young woman, 37 years of age, blew out her kidneys, had chronic kidney failure, on dialysis, and developed these horrible-looking wounds.
Sure.
She was at another hospital, and they said, all right, we're just going to cut your legs off, and that's it.
Oh, no.
Because your morbidity or mortality is that high. And she said, yeah, that's nice. I'm out of here. I'm going back to St. Mary's in Waterbury. I'm going to talk to my wound doctor. Now, it took us 8 months, but she healed completely. This was a year ago. She called us 3 weeks ago. She just got a kidney transplant.
Oh, my God.
Now, if that doesn't make a physician or a nurse or anyone smile, then there's nothing we can do to make you smile.
Congratulations. Congratulations to you, to the whole center.
Right. It's not only saving a life,
Yeah.
it's giving life to someone
Yeah.
who was going to be a bilateral amputee. She's got young kids.
Yeah.
Her sugars are perfect. She's got a kidney transplant. She said, I can't believe how good I'm doing.
Wow.
So that's what excites me, is the challenge of difficult wounds. How do we approach them? And again, not in a vacuum. I have no qualms, no thoughts about calling up ID, vascular, this one. What do you think? Surgery, where can we go with this?
Right.
And even in the surgical arena, I work with our colleagues in surgery all the time.
Right.
And bad traumas have come to us. We just had a kid, had a horrible trauma in New Haven, and they sent him to us to get his wound better. I talked to the plastic surgeon. He said, go for it. And I just sent him a letter because we discharged him. And he said, thank you. Remind me to use you guys again. So when you see people get better and they feel so much more relaxed and they feel comfortable in the center, and they come in and they give me a high five when I walk in the room.
That's beautiful.
That's a great feeling.
Yeah, that's a great feeling. And your patient satisfaction rates, I mean, off the charts.
Yeah, they are. And again, I contribute that more so than to the docs. I really contribute that to the nursing staff, the ancillary staff, how they're greeted when they walk in the door. We know everyone on a first name basis.
Right.
I mean, the cookies we get, the candies we get, the eggs we get. I was on my way in, so I stopped at the bakery. I know you guys like Donut Friday, and all this stuff adds to overall satisfaction of the patient.
It's remarkable to hear. It's a patient-centered focus, and clearly the team is working together. And working together, and not only within the team, within the entire St. Mary's community.
Correct.
To provide the care that's excellent for the patient, and the patient appreciates it. And that's clearly the fact, and the outcomes speak for themselves.
Yeah, it really is. It takes a village.
Yeah.
And it does. It takes a family, or it takes unity among the nurses, the ancillary staff, the physicians, and everyone else. And you can see it because yes, I'm the doctor, but I have no qualms when a nurse says, what if we tried this?
Yeah.
That's a good thought. Let's do it.
Right.
So there's this give and take. You're the ones wrapping the patients. You're the ones seeing the wounds when they first come in. So let's chat about where we're at on this and how we can make them better. And it really is a family that heals that patient.
Love it. One thing we always ask, of course, it's becoming culture now here. We'd love to have a pearl from you to our viewers on what we've been talking about, or something from your vault on pearls for our viewers. Sir.
Pearls for the viewers would be, overall, if you have a wound, don't let it sit. Call us. We're happy to see you. As I say, most patients are in 24 to 48 hours. And if something's festering, let us know right away. If you're diabetic, get your diabetes under control. If you smoke, quit smoking, have your vascular status checked. If you're overweight, work on getting your weight under control. If you're not eating properly, eat properly. And if you do all those other things and you have a wound, we can heal that wound, and not only for the immediate, but also keep you from getting more wounds in the future. It's early intervention, long-term survival.
Thank you so much. Really appreciate it, Dr.
My pleasure.
Jacoby. Thank you all for joining us, and we look forward to talking with you again next time.
Thank you.
Thank you.